Rick, thank you very much for joining me on the Stay Whole podcast. It's a pleasure to have you here. Thank you very much for taking that time out of your schedule. I'd like to dig in a little bit about, NuroKor and what they do. But first, I would like to know a little bit about yourself, who you are, what you do, and how you came to do what you're doing right now.
Thanks for the intro, Sanjay. It's my pleasure to be here. I'm the CEO and founder of NuroKor Bioelectronics. We're a little over a 3-year-old startup. I suppose the simplest explanation of what Neurocord does or is we are the bioelectrical version of a pharmaceutical company in that we develop electroceuticals as therapeutics in various areas, but in particular things like pain management and physical recovery, as well as things like tissue healing.
Fantastic. And how did you come into this? I mean, what's your background before this? How did you get into this line of work? Electroceuticals is actually the first time I've ever heard that word ever said out loud. And it's probably the first time a lot of people have heard that. I mean, we've heard of pharmaceuticals, and it's a nice way, it's a great description, is it? The equivalent of that. But how did that all come about?
It's not a super exciting story, and it was rather by accident, but I describe a lifelong back pain sufferer. I mean, I had other issues. And probably nearly 8 years ago now, I came across a TENS machine. So the humble TENS machine, which is, for those that don't know, it's one of the stimulation devices, or some people call them zappers, that the physios put on you that you can buy from pharmacy, etc. That produce electrical currents that are used for pain relief. Now, when I used it, I had relief like I'd never had before. So, I was on a cocktail of painkillers and anti-inflammatories for most of my life, to be honest, and it was getting worse as I got older. And it gave me relief like I'd never had before, but then another time when I would use it, it would do absolutely nothing. So first of all, I was excited about the fact that it worked, and disappointed, obviously, by the second part. So having quite a sort of scientific mind, I like to know how things work, and I'm quite a logical deductor, if you like. I started to look at the science, or lack of, it's probably a better description, of what sat behind these products and the technology. And once I started to look at that and, look at the various studies and the parameters that showed positive results and negative results, I started to understand that it was actually the parameters themselves which dictated, whether the application was correct, whether it would work or whether it wouldn't. And not only that, but, how it was suitable or might change its suitability for the individual. And that's where that sort of journey started. I got involved with an earlier company in Australia that was predominantly product focused, and that was sort of my first foray into it. But I felt that, there was much more to bioelectronics, as in the opportunity in electroceuticals. So using, bioelectronics or bioelectricity as therapeutics, other than just this nerve stim or muscle stim area. So NuroKor was formed. Formed from the outset with the intent of developing research and development and furtherment of bioelectronics as therapeutics. And we've come a long way in a short period of time. And back to your original question, no, I don't have a background in this area. I came from high-end real estate and retail predominantly prior to that.
Fantastic. So this area of bioelectronics and electroceuticals, just for those that may not be familiar with these terms, what do we mean when we talk about bioelectronics?
That's a good question. So bioelectronics is literally anything that, as the name implies, bridges between electronics or electrical hardware or into biology. So we could go back, to ancient Egyptian and Roman times, and clinicians were using electric eels or electric fish to treat things like migraines and pain. So they understood that, even from that time ago through to the Edison, Tesla era, whereby the early era of medical device technology using electricity, or bioelectricity, we call it, because it's the electricity within the body, started to develop. And fast forward to 20th century, where we were able to start controlling currents better and understanding how they sort of reacted in the body. But it took a bit of a backseat with the advent of the pharmaceutical uprising. I don't know what better word to use. Now it's making a resurgence, because as we understand it, even with pharmaceuticals, what you're actually affecting ultimately is a change in the body or cell function that ultimately has an electrical function. So we are electrical. If something happens to someone, you end up in hospital or under care, some of the first things they measure is your vitals. And it's electricity or bioelectricity, which is driving your nervous system, is driving your heart's pumping, your brain activity. All of these are bioelectrical activity. So if we don't have any bioelectrical activity, we're probably ceasing to exist in our understanding of how living things work. So it's all of the melding of those functions. Some basic bioelectronics you probably don't realize are things like pacemakers, defibrillators, cochlear implants, spinal cord stimulators. These are all bioelectronics, interfacing biology with electronics.
Yeah, I think everyone's familiar with the, watching medical documentaries of people getting out the zappers, as you call it, and giving someone a jolt, and that's effectively trying to stimulate that bioelectricity to obviously bring someone back into consciousness. It's a fascinating area, and the way we talk about, you mentioned pharmaceuticals and the rise of pharmaceuticals to treat pain, to treat conditions. Are we saying that what some of these pharmaceuticals, and again, this is maybe a general statement, but some of these pharmaceuticals are not getting to the root cause of what some of this pain is? I mean, if we're talking about just pain management, because we've kind of stumbled upon that, is it that this is a different way of approaching pain management in that it can help address cause or things that pharmaceuticals can't?
That's a potentially contentious question, but in saying that, yes is probably the simple answer. When you're taking a painkiller, essentially, pain is it's a signal, right? It's a signal from the body to the brain, and pharmaceuticals look to either inhibit that signal or some way interrupt it or reduce the receptors that are sending the signal, etc. So when we're using bioelectronics as an example, or we're using bioelectricity, it's more like a direct mechanical function. So we are, we're directly impacting that signal source, receptor source, whatever it may be. So we're just sort of taking a more direct route rather than the chemical route to create the same desired outcome.
Right. Okay, that makes sense. So we're just going directly to cause. It's a direct route, which makes sense. So where is this used for? I mean, we can. It's obviously on the surface of it. It's obviously easier for someone to just take a tablet or take a pill or to take a course of pharmaceuticals. But that's a different conversation. But I mean, where is this useful? Where can people put this to use? I mean, where are you seeing the successes with this technology?
So one area that we are seeing success in our recent patient survey was actually reduction, or in some cases elimination, of pain medication. So pain medication, for all their positives, still have the potential for toxicity or side effect profile. I mean, it just par for it. I'm sure everyone's aware of it. It's probably just not top of mind. So we can definitely have an impact there. But musculoskeletal issues in general, as in physical pain, from everything from arthritis, lower back pain, neck pain, shoulder, all your typical ailments, which affect more than 50% of the population on a fairly on a chronic level, in some way, shape, or form, is where we have the biggest immediate impact with our current technology. So our current product in market, technology in market. Going forward, everything from when we start to delve deeper into the science and the clinical side of things, such as using microcurrent, which is it's subsensory, so you cannot feel the stimulations working at cellular current level. We can start to look at improving things at root cause, as you've just mentioned, such as inflammation, which, using sinus pain as an example. Now, sinus pain stems from an inflammation of the sinuses. if you can reduce that inflammation reaction, then of course, ultimately you reduce the pain. Similarly, when you've got arthritis or some other trigger, because inflammation is often a root cause of at least initiation of that pain issue, if you can control the root cause, i.e. the inflammation, then you have a better chance of managing, at a physiological level as a benefit other than just masking something.
Wow. So we're actually talking, you mentioned sometimes the elimination of taking pharmaceutical pain management, and would this be, would this new therapy be instead of, and they would be doing this therapy for however long, or is this something that we can actually say, okay, we can start using this treatment and eventually we don't need any other form of help to manage pain?
So we don't present it as that. We present it as an adjunct to existing therapies, so to improve those outcomes, to give patients and customers and clinicians another choice. So, another solution, because the problem too with the analgesic ladder is it only goes one way, and that is that it goes up. And, I don't think there'd be any doctor, GP, or pain specialist that would say otherwise. So you either need to help the patient through lifestyle choices or other interventions to reduce that, but you're never going to reduce the issue with painkillers. Painkillers is just simply a solution to the problem, a solution to the symptomatic problem. So we don't present it as that. We present it as an adjunct or an alternative. But our own data suggests that for those, there's a strong, a very large percentage who are able to reduce or eliminate pain medication using bioelectronics or using the technology.
Yeah, and I think this is an important area. And you mentioned this is recent. This is what you've seen. There's been a high rate of success here, and I think there's also just a general shift. People's mindsets want to shift away from taking pharmaceuticals. We know there's problems with opioid addiction and all these other aspects. Which do come with that world. And I think trying to find alternative, natural, safe remedies and things to aid, because people can be living with pain for quite some time, and if we're in pain, it drastically reduces the quality of our lives. And I meet people all the time who say, "Oh, I've got this pain, but it's been there forever. It's just always there." And I'm like you said, that's a signal. That's a signal from your brain saying something's not quite right here, and we need to address that. But we're in this culture where we just kind of we just get on with it and we mask things. And at some point in time, if we don't manage it, of course, that's when it can come back and harm us in the future. So I think it's vitally important that we have these remedies.
Yeah, absolutely. So, interestingly, in the recent study that we did, is there was over 60% actually reported improvement of quality of life, which obviously is a big factor. Over 70% reported improvement in sleep. And I've somewhere, don't quote me on this exactly, somewhere between 50 to 60% reported improvement in mood. Because, I know from my own fact that having that pain or that potential for pain just sitting like a weight on your shoulders is just this constant thing that you're always thinking about. If I pick up my kids, is my back going to trigger, if I'm tying my shoelace, pulling my shoe on incorrectly, all of these little things. And it is a weight, and it does affect you mentally. And when you actually are suffering, it's quite isolating. There's numerous sort of peripheral factors that are also involved.
Yeah, absolutely. Because I do some work on the diabetes prevention program here in the UK, and that is all about improving people's quality of life and making lifestyle changes. And even though people have made all the lifestyle changes and done all the mindfulness and all of the things that we talk about in the program, when they have physical things like pain, it's a big block. It's a major block. It's like, yes, Sanjay, I've done that. I'm losing a bit of weight. I'm feeling better, but my back still hurts, or my shoulders still giving me trouble. And that could the alleviation of that can just be the opening of just a whole new way of life.
Yeah, well, interesting. It's probably a subject all on its own, but diabetes or diabetic patients is a big opportunity for us, one that we're having very good inroads. Matter of fact, we're creating a case study series right now around data and diabetic patients, diabetic neuropathy, improvement in lower limb circulation, a whole range of things that bioelectronics or electroceuticals as therapies can have an impact on. And diabetes, unfortunately, is increasing at a rapid rate. It's not getting better. So, as you've said, whether that's lifestyle or not is not really the core issue. It's how do we best help those people that need it.
Yeah, I think, and I know that there's a lot of work. I've looked at your website and seen there's a drive towards diabetes, obesity, all these other conditions. I think if this can be proven on a large scale to be very effective, I really think it's just another step in this. We talk about lifestyle medicine. It's just another step in this way of helping people, without going down the road of ending up in a hospital, which I think is fantastic, and I'm all for that. So absolutely. So yeah, we got pain management. So there's obviously we can help people with pain, and this is anyone. We're not just talking about a specific type group of people. Whatever the pain is, they can be helped. The other areas that you talk about that this technology is helpful is performance and recovery. Can we touch on those a little bit?
Sure. So, when you talk about things like diabetic patients and lower limb circulation, so often the calf muscle is referred to the second heart of the body, particularly the lower circulatory system, in that it helps with circulation through the lower limbs, and lower limb circulation has a big effect on overall health. So, if we're able to improve circulation in a diabetic, then of course it almost goes without saying we can help improve circulation in an athlete. So an athlete post training will look to either have a warm down or a recovery session, which involves low level stress with regards to keeping active or keeping that circulation up, because fresh blood, oxygen, nutrients, etc., all helps in that recovery process. So that's it at a mechanical function level. So we can, through external stimulation of the lower limb or application of microcurrent at the cellular level, we can improve these markers. But the other part of that is actually the ability for microcurrent to normalize cellular current or normalize tissue function quickly. So when you've got damaged tissue, the current level or impedance level of the cells can change or does change, and applying external microcurrent can accelerate the normalization of that. So that's on the recovery side. The performance side is a little bit more technical, and it also is relative to the user, but there's plenty of evidence around things like change in muscle fiber type, to additional recruitment of fiber for torque or strength gains. So a very lay example is if you were to do a squat, as an example, regardless of how heavy and how hard you strained, your body will always keep fiber in reserve. It never activates 100% of the fiber. Through external stimulation and correct parameters, we can actually increase the amount of fiber recruited, the muscle fibers recruited. So we can increase torque strength. And the thing is that once that process and diminishing returns happen on average from studies around the 6-week mark for elite athletes, you maintain that additional recruitment, aside from also the fact that you're able to work more muscle fiber with your sets. So there's this larger activation in general of training efficiency.
So it's not just it's not just if I'm doing a lift, it's not like I have to wear the device to get that benefit. I can wear the device, but with training with that device, I can keep some of the gains, so I don't need to be. So if I'm going into competition, of course, I'm not allowed to wear that device on me. So I'm still getting the benefits of having trained with the device. Is that what you're saying?
Yes, correct. So yeah, it's just making that training more efficient, because essentially you are doing more of what it is that you're getting more out of what your training is intended for. And the other side of that is things like muscle wastage in the aging. So as we get older and we become less mobile, we lose muscle. So there's plenty, not our studies specifically, but there's studies around use of particular protocols for improving or reducing muscle wastage. And similarly, things whenever you've got, for instance, an arthritic knee or a painful knee or a painful joint, the body starts to shut down the activation of the muscles surrounding that joint to protect it, so that you're not, loading, or it's reducing the load on or stress on that joint. Similarly, we can help improve that functional strength, and we've got a number of strength and conditioning trainers and clinicians who are doing exactly that.
Yeah, fantastic. I mean, I was looking through, and I've got it open here, the performance, some of the statistics that you've come up with. It's just fantastic. It's 79% in increase in isometric strength, and 4% increase in sprint times, and vertical jumps, and force impulse. I mean, there's some, and this is, I guess, this is based on athletes already. So these are people that are already performing at a specific level. It's all good and well if you're starting at a baseline of a couch potato, and
Yeah.
you're going to see gains. You're going to get numbers like 79%. We're talking about people that already are performing at quite an elite level, and we're seeing these type of gains in them, which is phenomenal.
Yeah, and look, again, this is not so new. What is exciting about it is, I mean, this has been around since the 60s. So the Soviets were using it in the 60s. When you go through the 80s and 90s, coaches to the like Charlie Francis of Ben Johnson fame, the Canadian sprint coach, they were he's the godfather of EMS. Sometimes is referred to. They were aware of these improvements and were developing some of the protocols that we utilize today. But the beauty of today's technology is that we can be so precise with the protocol and the personalization of those protocols for purpose, and also too then the physiological measurements that bioelectronics in some regards is going to come into its own in the electronics age, in the biosensor data age, because it fits absolutely perfect. It's connectivity to technology and even things like algorithm. It's very infancy with, I think, explosive growth.
Yeah, I mean, if you think about modern, health data points that we get now already from things like smartwatches and smartphones, it's you get your heart rate. I can get my heart rate variability from a training perspective, blood oxygen, all these things which are becoming mainstream. Why not have data on what my muscles are doing, and where there might be
or your inflammation,
absolutely,
or adapting to what's working for your pain levels, all of these things, which bioelectronics sort of fits. Is a perfect fit for technology.
Yeah. Yeah. So how would someone, because again, this sounds great, and it does sound like something, when I was a kid, you hear about these things and you think, oh wow, this must be, some large contraption that, you have to go to some special sports rehabilitation or sports performance place to use. How does someone go about using this? And how are these devices, how do they work, and are they relatively mobile?
Yeah. So the current, using an industry term, MVP, which is minimum viable product. So essentially our first generation of product, which, hardware wise, it works well. I'm not going to say it's groundbreaking, but obviously the technology that's in it is our core technology, and it's delivering advanced protocol or formula in that regard. So we have two products primarily: the handheld, which is a more advanced unit with sort of a larger menu and additional modalities and therapies within it. Still simple to use. We've sort of distilled it down into 5 apps, if you like. And then we have an ultra-wearable, which is a portable device that can fit under your clothes. You can wear it under your pants or on your knee, or during training. It's lightweight. So we do a lot of work with the UK or British bobsled team, and they use the devices while sprint training or hurdles, launches. Yeah, it's that portable. So it's simply a matter of, depending on the use, but basically attaching it, which is adhesive pads, reusable adhesive pads, turning it on, and then selecting the mode or intensity which is suitable for your needs, whether that's pain management or whether that is for training purposes. They are quite simple to use. But similarly, like any tool, so whether it's a dumbbell, or a rowing machine, it takes you a little while to find your own rhythm. But aside from that initial sort of acclimatization stage, very simple and easy to use.
And you mentioned there's attachment points. I mean, does the user need to be aware of where they need to attach this and which points do they need that level of understanding of anatomy or to be able to do that?
It depends on. So the more advanced, the higher the level of understanding for the user. I can't say that they won't get more out of it, because they will, but it does not inhibit the novice user or the first time user or the initial user from getting great benefits from it. It's just that as you become more familiar with the technology, and as you become more familiar with your body and the use of that technology, you'll get more from it. So in some respects, it's good, because it will grow with you as your sort of user expertise or experience becomes higher.
Sure. Yeah, I'm thinking obviously from a sports and performance perspective, these people are going to have coaches, they're going to have teams, they're going to have professionals who can help them with this and have that understanding. I'm thinking we're looking at the other end of things. We talked about pain management, diabetes, all these. At that level, people are not going to have that level of knowledge. So is this first something that they would get some help with? And I guess the question is, if someone wants to, has an ongoing chronic pain issue and they want to start doing this, do they have to do it under the guidance of a doctor? I mean, where would they go?
So going back to the MVP product analogy, this has ended up in professional sport. Our products have ended up, this current product has ended up in professional sport and clinical use, for which it was never actually designed for, right? It's designed as an over-the-counter consumer, lifestyle solution, pain solution. So in answer to your question, I mean, most of our users, so we do run pain clinics through community pharmacy, as an example. We do also have products supplied through GPs. We've currently got a drug tariff application in, so they can be prescribed. So yes, of course, you can use the product in consultation or collaboration with your healthcare specialist, but it is also an over-the-counter product. So you literally can buy the product or use the product straight out of the box with, for most users, a positive result. If you want to take it a step further, of course, there's plenty of area specialists, whether that's in training or whether that's, for pain management. And, part of our roadmap is around healthcare education. So we've recently launched a CPD course on using the technology for pain, particularly focused or aimed at GPs, physios, and pharmacies. There's a bit of education behind it, but at the same time, we have distilled these products into easy-to-use, consumer-focused versions. So I would say that most people would be able to just use it themselves without that need for specialist advice.
Great, and I've got this. This is one of the products here, isn't it? This is the wearable. This wasn't planned, by the way. This wasn't. Rick didn't plant this, but actually, this was given to us by Mark Hopkins.
You met Mark, yes.
Yeah, so Mark went on my wife's podcast. It's a pharmacy podcast. So Mark, as you mentioned, the community pharmacies doing pain clinics. So they're using the pharmacy to help put this into the community. And I think that's a great way. That's a great use of something that's already out in the community that people are already used to going to and they're probably going there for pain medication anyway. So if there's an alternative therapy that they can use that's relatively easy and off the shelf, then I think that's fantastic. So I haven't opened it, but I'm gonna be trying out. Hence my questions, because I've got a bit of understanding. I've got a sports science background, but at the same time, I'm looking at this through my consumer eyes and thinking and I'm someone that likes technology, so I'm quite keen to dig in. But how easy it is going to be. So I guess I'll do that and I'll report back.
Well, fortunately, that's the simplest.
The two. Start us off easy then.
Yeah, I'm no obligation. I'm just going to make you feel guilty if it's not easy. But I mean, look, Mark and our other community pharmacists are doing an amazing job with the pain clinics, and they have been a huge hit. And some of the stories and case studies that have come out of those for us have been very, very positive, and we're really pleased.
Yeah, I mean, for people that are listening, I'll rather than going over that, I'll listen to that podcast that Mark did with my wife Anisha, because he does talk about a lot about the results that they're getting, and it's just, again, distilling it from, this is something for elite performers and the elite athletes, to this is actually something that can help everyone out, and it doesn't matter if you're a weekend warrior when it comes to training, or you are taking it more seriously, or like you said, you're just trying to manage pain and just live a better quality of life. And I think that's where it's going to be useful. So yeah, I'm gonna test it out over the next few weeks, and I'll share my findings with people to let them know how I got on. Where can people find out more, Mark, about the products, about NuroKor, and about the work that you're doing?
So for any professionals, we are quite active on LinkedIn, and we've got some amazing engagement there, but also on the traditional channels such as Instagram and Facebook, etc. Or the company website is neurokor.com, NUROKOR.com, and if you use the .co.uk string on that, it'll take you to the product site. You can find it through the main site anyway. But yeah, either that or any of the social channels, you should be able to find us by name.
Fantastic. Well, I'll find all those. I'll get all those links and pop them into the show notes for everyone, and direct them to have a look. And just even if it's just to stoke your interest, have a look at some of the work on there. Have a look at some of the research that's been done. I think it's, for me. I mean, like I said, I geek out on this stuff. So it's.
Would you like a draft of our white paper, Sanjay?
I would love to. Yeah, we can get into that on part 2 for sure.
Sounds good.
But I think it's just. I'm a technology enthusiast, so for me, and also I'm a health enthusiast. I want to improve people's well-being and health, and I think anything that can make our lives easier, give us more data. I wear these watches not because it's fancy, but it's because I'm interested. What is my heart rate doing? What is this doing? And having more information, as long as you know how to use that information, then it's only going to help us, as we go forward.
Agreed. And for us, we see the future of medicine to be a more collaborative approach towards clinician and patient. And the thing is that technology can bridge that that collaboration, so that, because in the past it was, you got a test, your doctor got the results or your clinician got the results, and then they would have to interpret those results to you, and it was not a collaborative relationship. With the advent of technology, it's becoming more and more collaborative, and to the point where the doctor's there, or should be in the future there, to help you manage whatever interventions you're using, whether it's your health watch or whether it's our products or what have you. It's for them and the patient to have that sort of journey and relationship together, because those who are engaged in active management of their health always seem to do better.
Yeah, I couldn't agree more. Rick, thank you so much for your time and your explanation and your insight into NuroKor and the products. I'm really excited about this field and this whole area of technology helping us with our health. So I'm really keen to keep an eye out on what you're doing and see you grow, and hopefully see not bigger, but better products in the future, but bigger and better products in the future.
Yeah, they're coming. Thanks, Sanjay. Appreciate it.
All right, thank you.
Cheers.